number of new coronavirus cases reported in Los Angeles County over the last 24 hours is 698, with 28 additional deaths. Here in Torrance, 3 additional cases were reported with no new deaths. Welcome to COVID-19 Today. I'm Riannon Trutanich. It's Tuesday, March 15th. Hospitalizations are continuing to decline here in LA County, a welcome sign for our healthcare heroes. Public health officials say the lower rate of COVID-19 transmission is reducing stress on the healthcare system and providing much-needed relief to healthcare workers who are at elevated risk. 491 people were hospitalized this Monday, representing a 32% decrease from 1 week ago. It's the first time LA County has had fewer than 500 people in hospital beds since July 17, 2021. The 7-day average of new daily admissions of people with the coronavirus went down by 38%, and just 20% of COVID-positive hospitalized patients are in the ICU. More good news, cases among healthcare workers are decreasing as well. Between February 27th and March 5th, Public Health reported 80 new positive cases among this group, a decrease of 93% compared to the week of December 26th. Given the elevated risk among patients and healthcare workers, several safety requirements remain in place at healthcare facilities, including the requirement that everyone wear a mask regardless of vaccination status. Public health officials remind everyone that N95, KN95, and KF94 respirators offer the highest level of protection. There have been a lot of changes in recent weeks regarding mask wearing and other COVID-related protocols. To help answer any questions and to provide the most updated information, the LA County Public Health Department is hosting another COVID-19 virtual town hall. It takes place tomorrow, March 16th at 6 p.m. Public health officials will discuss their post-surge plans and also talk about vaccinations, boosters, school guidance, and therapeutics. Questions can be submitted at tinyurl.com/LACtownhall0316. The meeting will be streamed live on Facebook, Twitter, and YouTube at LA Public Health. The White House told Congress today about its plans to scale back its COVID-19 response efforts due to a lack of funding. Press Secretary Jen Psaki previewed the cuts on Monday, saying some programs could end abruptly if more money is not made available. Starting next week, the White House will wind down a program that pays to test, treat, and vaccinate people who don't have health insurance. It's one of several immediate impacts after Congress declined to add $22.5 billion in funding to a broad government spending bill that passed last week. Psaki warned earlier this month that the monoclonal antibody supply would run out by May. The supply of pre-exposure prophylaxis drugs used to protect immunocompromised people would run out by July, and the supply of oral antiviral pills would run out by September if no funding is available. Today, the White House confirmed it will have to cut back shipments of monoclonal antibody treatments to states by 30% next week due to the lack of funding. New COVID-19 cases in China more than doubled over just one day, and 37 million people are currently living under a lockdown. The country is facing its biggest outbreak since the early days of the pandemic. The National Health Commission says more than 3,500 new local cases were identified in the latest 24-hour period, up from about 1,300 a day earlier. A fast-spreading variant known as the stealth Omicron is challenging China's zero-tolerance strategy, which had kept case counts low for much of the pandemic. China has recorded more than 10,000 cases over the first 2 weeks of March, far exceeding previous spikes. Nearly 3/4 of China's new infections were in Jilin, a province in the northeast that reported just over 2,600 cases. Smaller outbreaks hit more than a dozen provinces and major cities, including Beijing and Shanghai. Jilin has barred residents from leaving the province and from traveling between cities within it. The 9 million residents of Changshan, the provincial capital, an auto manufacturing hub, has been locked down since Friday as authorities conduct repeated rounds of mass testing both there and in Jilin. More than 1,000 medical workers flew in from other provinces along with pandemic response supplies, and the province mobilized 7,000 military reservists to help with response efforts. No new deaths were reported in the multiple outbreaks across the country, and the case count still remains low when compared to other parts of the world. The situation in Europe isn't looking good either. 2 weeks after the United Kingdom dropped its remaining COVID-19 mitigation measure, the country is seeing cases climb again, recording more than 444,000 in the past week, up 48% from the week before. Hospitalizations are also up 17% over the same period. Daily cases are on the rise in more than half of the countries in the European Union. The Netherlands saw a 48% jump, and Germany reported a 20% increase over the past week. Daily cases in Germany have yet to drop below pre-Omicron levels. Public health officials say the UK offers a preview of what may happen in the US. They also say something unusual seems to be happening. In previous waves, increases in COVID-19 hospitalizations lagged behind jumps in cases by about 10 days to 2 weeks. Now, in the UK, cases and hospitalizations seem to be rising right after one another, something that experts did not expect to see. Dr. Anthony Fauci, the director of the National Institute of Allergy and Infectious Diseases, says they're keenly interested in what's going on with that and has spoken with his UK counterparts. They believe 3 factors are in play: the BA.2 variant, which is more transmissible than the original Omicron, the opening of society with people mingling more indoors without masks, and the waning immunity from vaccination or prior infection. They're still trying to figure out why hospitalizations are going up when BA.2 does not seem to be causing more severe disease. While experts continue their research, they urge Americans to stay aware of what's going on in Europe in an effort to prevent that from happening here. The island nation of Mauritius has been added to the highest travel risk category. The U.S. Centers for Disease Control and Prevention added just that one destination to its Level 4 COVID-19 very high list this week. The East African nation on the Indian Ocean is known for its beaches, reefs, and waterfalls. The CDC places a destination at Level 4 when more than 500 cases per 100,000 residents are registered in the past 28 days. Mauritius recently logged a 180% increase in weekly cases. On a brighter note, many of the islands clustered in and around the Caribbean Sea are no longer in the highest risk category for travel. A total of 9 destinations, including the Bahamas, the Dominican Republic, and Jamaica, dropped down to Level 3. When the pandemic first arrived, the lack of toilet paper made national headlines. Now the bathroom tissue is back in the news for a different reason. Prices are going up and the rolls are getting smaller. Procter & Gamble's Charmin Mega Rolls aren't so mega anymore. The sheets shrank from 264 to 244, and its Super Mega is down 30 sheets from 396 per roll to 366. The company said earlier this year that they plan to raise prices in February and again in April. Costco's Kirkland brand toilet paper is also smaller. Rolls went from 425 to 380 sheets, while prices stayed the same. That's less than 3 rolls per packaging, although the label does say the new rolls are, quote, thicker than ever before. And Cottonelle also reduced its number of sheets on a variety of packaging. The strong version of its mega rolls went from 340 one-ply sheets to just 312, and the soft version from 284 two-ply sheets to 268. Analysts say Cottonelle rolls shrunk over the years, so this is not the first time that the sheets are being cut short. This all comes as inflation continues to rise throughout the country. Several food and beverage items are being recalled due to safety concerns. More than 1,600 pounds of jerky products are being pulled because of a possible listeria contamination. 83 separate packages featuring various brands and flavors were produced by Boyd Specialties, LLC, and shipped to retail locations across the U.S., including California. Starbucks recalled more than 250,000 cases of 3 Starbucks double-shot espresso drink varieties due to an issue with packaging where the cans were inadequately sealed. All recalled drinks were sold in 6.5 fluid-ounce cans. And Trader Joe's is recalling one of its fresh, pre-packaged salads called Crunchy Slaw with chicken, crispy noodles, and peanut dressing because there may be hard plastic in the dressing. The U.S. Food and Drug Administration's Food Safety and Inspection Service issued a public health alert regarding the matter last Thursday. Consumers who bought any of these products should throw them out or return them to the place of purchase. Gas prices continue to climb, making a bigger dent in our wallets each time we go to the pump. Prices here in LA County shot up nearly 22% in the last 3 weeks. The average price for a gallon of regular grade gas today was $5.83, and analysts say now it's more important than ever to know where and when to fill up in order to save as much as we can. In general, they say gas prices tend to be the lowest at the beginning of the week on Monday and Tuesday. Prices are likely to rise as the week goes on until they reach their most expensive point on the weekend, especially on Friday and Saturday. The reason for this shift isn't clear, but analysts say energy markets are closed over the weekend, and by that time, gas stations may be passing on any increases that happened earlier in the week to consumers. There's also a key government report that comes out every Wednesday, which can influence the wholesale price of oil, and gas stations are less likely to lower prices on the weekends because that's when many people tend to fill up. Analysts also say prices vary from place to place, and what's going on in the oil markets can affect prices at any given time. The average gas station will change prices a few times a week, but there may be volatile times where a station changes prices several times a day, especially if they see their competition's prices rising. Analysts say it's a good idea to shop around. Doing so can save up to $300 a year. The Torrance City Council meets tonight to conduct city business. Among the agenda items to be discussed is an item regarding purchase orders to furnish water treatment chemicals for the North Torrance well field facility. The City Council will also review a request from the Public Works Department regarding a 2-year residential and arterial pavement improvement project. And the city leaders will hear from the Community Development Department and community members about a proposal to build an automatic car wash facility at 2880 Sepulveda Boulevard. While the council chambers will be closed to the public in the interest of maintaining appropriate social distancing and helping to reduce the risk of spreading COVID-19, the public can participate before the meeting tonight by emailing council meeting public comment at torranceca.gov or by calling in during the meeting. You can watch the meeting live on our website, YouTube, Facebook, and of course right here on City Cable beginning at 6:30 p.m. Well, before we go, at the end of each program, we like to share feel-good stories from our community. Pictures, images, and videos that remind us of how resilient our community is and how Torrance truly cares. Caring House, a Torrance-based nonprofit helping those who are going through their end-of-life journeys, recently received some thoughtful care packages from a local nurse.
This care package is created for the families because so often we think about the person who is dying with dignity, but we often forget about the families. And that's what I felt like as a nurse, that I was giving back to all those families that I didn't take care of in the past.
Registered nurse Kathy Levy created these gifts as a part of her master's program in nursing administration and hopes they can provide some comfort to those who are experiencing difficult times. Caring House was established to ease the burden often associated with caring for a loved one at the end of life. This tranquil, home-based setting is the only one of its kind in LA County. What a thoughtful way to show how Torrance truly cares. Now, if you have a great story, an upcoming event, a photo or video you'd like to share, email us at covid19today@torranceca.gov. We'd love to hear from you. Well, that's our update for COVID-19 today. We'll see you back here tomorrow as Christine Lee brings you the latest. Be safe, stay healthy, and thanks for tuning in. We'll see you next time.